President John Dramani Mahama has called for a decisive shift in global and African health systems towards preventive care, stressing that investing in prevention is far more effective and sustainable than relying solely on treatment. Speaking at the One Health Summit 2026 in Lyon, France on Tuesday, President Mahama urged governments to prioritize early detection, earlier, healthier lifestyle, and stronger public health systems as part of a broader health reform agenda. The president warned that recent global outbreaks, including COVID-19, Mpox, Lassa fever, and Marburg disease, have exposed weaknesses in fragmented health systems and underscore the need for a more integrated approach linking human, animal, and environmental health under the One Health framework. He also called for African countries to draw on indigenous knowledge systems alongside modern science to strengthen healthcare delivery and community resilience. President Mahama further urged African nations to reclaim their native practices and more actively draw on their heritage of integrated living, arguing that blending tradition with modern innovation could improve health outcomes across the continent.
Since the dawn of African civilization, from Songhai to Great Zimbabwe, from Timbuktu to Axum, and to ancient Egypt, traditional knowledge incorporated systems for diagnosing and treating chronic ailments, for dealing with plagues and pests, and even the practice of terrace farming. This knowledge has always been with us. What has been needed in recent times has been for experience to intersect with it. Over the past decades, we have faced pandemics and plagues, from COVID-19 to Mpox, Lassa fever, and Marburg. Each crisis has highlighted the importance of the One Health approach. We must reclaim our native practices and more actively draw on our heritage of integrated living across the continent. These public health emergencies have also taught us a simple truth, that prevention is not only more effective but also much more cost-effective than cure. And so in Ghana, our rollout of the Ghana Medical Trust Fund and our free primary health care programs are all new instruments to improve health outcomes for our population. These two programs will aim at lifestyle changes and preventive care, incorporating traditional knowledge. We must also take note of the changing disease burden in Africa, including the explosion of morbidity in non-communicable diseases. In Ghana, non-communicable diseases today account for 42% of all mortality. Infectious disease burdens also are changing, are varying, and so we must take note of all this.
President John Dramani Mahama called for urgent global cooperation to confront the growing health risk driven by climate change, ecosystem degradation, and environmental pollution, warning that the most vulnerable countries could face the greatest burden with the least support. President Mahama said global health threats are increasingly interconnected and require coordinated international action to prevent worsening crisis.
The drivers of today's health threats, from climate change and ecosystem degradation to species conflicts and loss of natural barriers, are reinforcing each other. Not to talk about plastic pollution, which is poisoning all our ecosystems. We must advance international action in dealing with plastic pollution. Regrettably, as I speak to you today, the countries that are most at risk have the least resources to cope. This must change. The world must face the stark and uncompromising fact that a healthy and thriving Africa is no threat to anyone. It will be a positive force for global progress. We must therefore ensure fair access to financing, technology, data, and innovation. We need to enhance research and knowledge sharing. Additionally, we must support countries in building resilient systems that can prevent, detect, and respond effectively. Although we have frequently discussed this, we have been slow in developing the necessary infrastructure for delivery. Let's master the political will to integrate our fragmented regulatory environments and let Lyon be the turning point.